For so long, we focused on really expensive medication and interventions and overlooked the need for the basics, which is adequate nutrition and hydration for our patients.
You're talking about the costs amounting to perhaps 19.6 billion of malnutrition across social and health care. And we know from the evidence in hospitals, where there is hard evidence, that you can save low hundreds of millions there, but we suspect that if you apply the same science, the same evidence that it's going to work to the broad population and the 19.6, you're going to get into billions of pounds saved.
You can have the best menu in the world, but if there aren't the staff there or the volunteers there to feed the patients, then they're just going to slide into frank malnutrition.
I'm a dining companion, just here to help people that need a little bit of help with their meal. You've got your tea here as well, look. How's the food been? Put yourself in the place of that patient, because that's actually the point at which you start to understand what it's like to have a meal put on a trolley which is just out of reach to you and you can't get to it, and by the time you do it's cold. You need to put yourself in a bed in your head so that you can see and feel and know what that might be like, or your mother or your father or your child. Some days you can just be on here, literally walking around, opening sachets, filling jugs of water, but all that makes for the individual, you know, wanting to eat their meal.
Well, one lady was incredibly complimentary, and she described the volunteers as an angel and said that actually her husband had enjoyed his meal for the first time since being in hospital. And for me that's so impactful, and that really tells a wonderful story. These, which are guards around food, which help people to hold the food onto their plates so they can eat independently, volunteers are able to say we need more of those. They might say more to a volunteer who's acting as a companion, more of a friend, more of a social action, and that's what's really important. So it's a much more comfortable experience or means of being able to give feedback.
Okay, and that works quite well then here, I think, doesn't it? Because you can have, I think, sandwiches either or. Okay, staying in, okay.
If you're sick and you cannot, you have to be spoon-fed. It can be, you know, reassuring, or, you know, how are you feeling today? And contact with a different face is nice.
So we can take, you know, time to just sit and listen, time to talk to them, trying to encourage them, with not a feeling of, oh right, I've got to go and do this or I've got to go and do that. Eating should be a social, you know, a social time, whether you're in hospital or whether you're not. And we can see with a lot of patients that we sit with that as we talk, they will eat.
And they come in as much as they can, and all our healthcare assistants really look forward to them coming in because it's extra help for them, it's lovely for the patients. Also conversation, some of our patients don't have visitors, some of our patients take longer to eat, and it's lovely because they can have a one-to-one with our volunteer. It's lovely for the patients and it's lovely for us.
So the Nutritional Care Tool really provides us with a bank of evidence that we can use, not only to show what's working, but also to show what isn't working. The tool itself is a web-based tool, so it's accessible. You have to register for it, register your organisation, and then it is literally very simply a follow the process data entry form, save your data, and then instantly that information is presented back in really simple graphics, looking at change over time. We've got about 28 organisations using it at the moment, and not just hospitals, care homes, community organisations, so using the tool to really assess their quality of nutritional care right at the front line. And we've already had some great examples where senior clinicians have been asking for individual ward level data so they can go back and have meaningful discussions with their teams. And that kind of clear line of sight between the technology and all the informatics and the geeky stuff and delivery of high quality care on the ground absolutely gets me out of bed in the morning.
So maybe you don't want to go home this evening, Emmy, so
I don't.
we can
Please, may I stay in?
It's been nice talking to you.
Nice talking to you.